What is actinic keratosis? An actinic keratosis is a rough, scaly patch on your skin that develops from years of exposure to the sun. It is most commonly found on your face, lips, ears, back of your hand, forearm, scalps, or neck, also known as solar keratosis. An actinic keratosis enlarges slowly and usually causes no sign or symptom other than a patch or a small spot on your skin. These patches take years to develop, usually first appearing in people over the age of 40 years. A small percentage of actinic keratosis lesions can eventually become skin cancer. You can reduce your risk of actinic keratosis by minimizing your skin sun exposure and protecting your skin from ultraviolet rays. What are the symptoms? The sign and symptom of actinic keratosis include a rough, dry, or scaly patch of skin, usually less than 1 inch in diameter, flat to slightly raised patch or bumped on the top of your layer of skin. In some cases, a hard, wart-like surface, color as varied as pink or red-brown, itching or burning in your affected area. Actinic keratosis are found primarily on areas exposed to the sun, such as your face, lips, ears, hands, forearms, scalps, and neck. When to see the doctor? It can be difficult to distinguish between the non-cancerous spot and cancerous one, so it is the best to have new skin changes evaluated by the doctor, especially if a spot or lesion persists, grow, or bleed. What are the causes? An actinic keratosis is caused by frequent or intense exposure to the ultraviolet rays from the sun or tanning bed. Risk factors. Anyone can develop actinic keratosis, but you may be more likely to develop the condition if you older than 40 years old, live in a sunny place, have a history of frequent or intense sun exposure, have a red or blonde hair or blue or light colored eyes, tend to prickle or burn when exposed to the sunlight, have a personal history of actinic keratosis or skin cancer, have a weak immune system as a result of chemotherapy, leukemia, AIDS, or organ transplant medication. What are the complications? If treated early, almost all actinic keratosis can be cleared up or removed before they develop into the skin cancer. If left untreated, some of these spots may progress to squamous cell carcinoma, a type of cancer that usually isn't life-threatening if detected and treated early. What are the prevention? Prevention of actinic keratosis is important because the condition can precede cancer or an early form of skin cancer. Sun safety is necessary to help prevent development and recurrence of actinic keratosis patches and spots. Take these steps to protect you from sun skin cancer. Limit your time in the sun, especially avoid time in the sun between 10 a.m. and 2 p.m. and avoiding staying in the sun so long so you will get a sunburn or suntan. Both result in skin damage that can increase your risk of developing actinic keratosis and skin cancer. Sun exposure accumulated over time may also cause actinic keratosis. Use sunscreen. Daily use of sunscreen reduces the development of actinic keratosis before spending time outdoor. Apply a broad spectrum sunscreen with a sun protection factor of at least 30. The American Academy of Dermatology recommends using broad spectrum water resistant sunscreen with a SPF at least 30. Use sunscreen on all exposed skin and use lip balm with sunscreen on your lip. Apply sunscreen 15 minutes before sun exposure. Reapply it every 2 hours or more often if you are swimming or perspiring. Cover up. For extra protection from the sun, wear tightly woven clothing that cover your arm and legs. Also wear a broad brimmed hat which provides more protection than does a baseball cap or golf visor. You might also consider wearing clothing or outdoor gear specially designed to provide you sun protection. Avoid tanning beds. The ultraviolet exposure from the tanning bed can cause just as much skin damage as tan acquired from sun. Check your skin regularly and report changes to your doctor. Examine your skin regularly, looking for the development of new skin growth or changes in existing moles, prickles, bumps, birthmarks. With the help of mirror, check your face, neck, ears, scalp. Examine the top and underside of your arm and hand. Acute coronary syndrome is a term used to describe a range of conditions associated with sudden reduced blood flow to the heart.